And welcome back. It's the Public's Health, the show that puts you, the public, back in public health. And we hope you're having a great summer. But as with summer, we have to remember all of the things that cause us some challenges in summer. You've got the sun, you've got heat, and of course you've got mosquitoes. Well, mosquitoes bring with them West Nile virus. And West Nile virus is something that we can prevent by taking simple precautions. Our show today is going to remind us all of the kinds of precautions that we need to take, and hopefully we can get through this summer without having any cases like we've done in the past. We also want to show you a great new resource that Samuel Merritt College has in Oakland that supports the training of health professionals in Alameda County. It will train nurses, it'll train doctors, it'll train anesthetists, it'll train kids that are interested in health careers. We think it's an exciting new resource, and we're very glad that it's in our county. So stay tuned and enjoy the show.
Not all forms of life are visible, at least to the naked human eye. Some of these microscopic life forms are helpful. Others cause harm. The following looks at one of the more harmful. This time, it happened in Alameda, California. Close to homes, schools, and businesses, near the young and old. The victim was a lesser goldfinch. The killer was unimpressed by the bird's flight, unmoved by its sweet song. The strength of the killer overwhelmed the bird's defenses. It left the bird with wings too weak to fly, a throat too crippled to sing. But in death, it whispered the name of its killer, and science was listening. The killer was identified. It was the West Nile virus. West Nile virus is a mosquito-borne disease, common in Africa, West Asia, the Middle East, and more recently, found in North America. Human infection with West Nile virus may result in severe human meningitis or encephalitis and inflammation of the spinal cord and brain. West Nile virus was first isolated from a woman in the West Nile district of Uganda in 1937. It next materialized in Egypt in the 1950s. In 1957, there was an outbreak in Israel. The equine strain of the disease emerged in France in the early 1960s. Other outbreaks have occurred around the world. Health officials expect West Nile virus will continue to be an ongoing health risk worldwide. It's believed that it has now been established as a seasonal epidemic in North America, flaring in summer and continuing into fall. Most often, West Nile virus is spread by the bite of an infected mosquito. Mosquitoes become carriers when they feed on infected birds. The infected mosquitoes then spread the virus to humans and other animals when they bite. West Nile virus is not contagious. There is no current evidence it is spread person to person. It cannot spread through casual contact, such as touching or kissing a person with the virus, or by breathing in the virus. All donated blood is checked for West Nile virus before being used. The risk of getting the virus through blood transfusions and organ transplants is very small and should not prevent people who need surgery from having it. Transmission during pregnancy from mother to baby or transmission to an infant via breastfeeding is extremely rare. People typically develop symptoms from 3 to 14 days after they are bitten by an infected mosquito. Mild cases respond well to the same kinds of common treatments used for headache, fever, and body aches. The more severe forms of the illness usually require hospitalization. In rare situations, West Nile virus can cause death. There is currently no vaccine for humans against West Nile virus.
Well, West Nile virus is really causes a spectrum of human illness. Most people don't have any symptoms at all when they're bitten by a mosquito that's infected with the West Nile virus. 80% of people won't feel anything at all. Only 20% of people will feel something, and most of those people will feel pretty much a mild fever, maybe a little bit of fatigue, but nothing all that specific that they would be able to say, aha, this may be West Nile virus. And only a very small portion of people, very unfortunate number of people, about 1 out of every 150 that's infected with West Nile virus, will have significant neurological symptoms, such as meningitis, which is inflammation of the brain and spinal cord, which causes pain and headaches. And for those that are slightly less fortunate, they'll have meningitis and encephalitis, which is inflammation of the brain and spinal cord, but also the brain itself will become inflamed and start causing symptoms such as loss of consciousness, seizure, coma, and in some unfortunate cases, eventually death.
Birds are one of the main carriers of the disease. They can die or become ill. West Nile virus can be deadly for horses. However, an equine vaccine is available. Dogs and cats can be infected, but rarely become ill. They do not spread the virus. When it comes to West Nile virus, federal, state, and local government health experts have not been standing still. There are several methods used to detect and monitor the disease. One is the reporting of dead birds. Because mosquitoes acquire the virus from infected birds, the evidence obtained from birds can be crucial. The public is encouraged to make these reports to mosquito control agencies. Remember though, if you find one, do not handle a dead bird with your bare hands. Another method of monitoring the disease is a variation on the famous canary in a coal mine. Today's feathered lookout is the sentinel chicken. Flocks like this one are blood tested regularly by the Mosquito Abatement District. A positive blood test result, called seroconversion, indicates the presence of West Nile virus in the local mosquito population. Much like the diabetic who, testing for glucose, pricks the tip of their finger, this technician obtains a blood specimen from the comb of the chicken. Specimens from each bird are labeled, sent to the state laboratory, and tested for West Nile virus. These birds are unharmed by the procedure. Nor are they harmed if the virus does appear. The disease is fatal to other species, not this one. Once you appreciate the important role played by chickens in tracking this deadly disease, you might look upon these creatures as avian volunteers in service to science. It is also possible to trap mosquitoes and test them for the virus. A batch of 50 or so mosquitoes tested together is called a pool. Pools are collected in various locations throughout the season and provide important viral data. Marshes and circulation ditches with standing water are prime locations for mosquitoes to lay eggs. These areas are physically drained of water, resulting in fewer mosquitoes. The Mosquito Abatement District inspects known mosquito sources and then uses the appropriate form of mosquito control. One species of mosquito lives in tree holes, like these located on the Mills College campus. Holes are treated with a hormone which interrupts the life cycle of the mosquito, preventing it from reaching the adult stage. Control of rural ponds and even urban pools like this one is accomplished by stocking with mosquito fish, or gambusia, with the appetite of a great white shark packed into its 3-inch size. A large mosquito fish can devour 100 or more mosquito larvae in a single day. These fish can be obtained for ponds or pools by contacting the Mosquito Abatement District.
According to UC Davis, according to our veterinarians, all horses should be vaccinated for West Nile virus. The best time to start the vaccinations are in early spring, around March or April, when the mosquito season around here actually starts. We get pretty bad mosquitoes in February here from the rainy season, but as long as the rainy season goes on and it starts to warm up, then you get mosquitoes. The horses need to be vaccinated once and then a booster vaccine given to them 3 to 4 weeks later for initial vaccine. Then they should be vaccinated every 6 months for West Nile. So normally horses are vaccinated twice a year for a variety of different diseases. There's spring and fall shots, and if people give their horses a routine West Nile vaccination during that time period, the horses will be covered. The fatality rate for horses is about 30% on West Nile, so that's a big percentage. So it is very important to get the horses vaccinated. The best thing is to get them inoculated. The inoculations are 95% effective, so there's no reason not to. It doesn't cost that much money, and it'll save you a lot of heartache in the long run.
Humans have another defensive weapon which they can use to prevent infection: common sense. We know that mosquitoes which may carry West Nile virus are most active during the dawn and dusk hours. Use common sense. Avoid going outdoors at those times. Whenever you're outdoors, wear long pants and long sleeves. It also makes sense to use a repellent. Choose one containing the ingredient DEET, or perhaps one with oil of lemon eucalyptus. Learn more about repellents from the CDC website. Keep a stockpile of the common sense weapon in your arsenal. Water. Standing water is the mosquito nursery, the insects hatching in a week or less, in as little as a ½ inch of water. If you get rid of still or stagnant water, at least weekly, you will keep many mosquitoes from breeding and take a big step toward protecting yourself and your family. Take these steps to make your personal environment safer. BTI is a natural bacteria that kills mosquito and fly larvae, yet is non-toxic to fish and animals when used properly. It kills mosquito larvae developing in water. In tests, traps that use carbon dioxide, or CO2, have been effective at reducing mosquito populations in the immediate area. On the other hand, university studies have repeatedly demonstrated that ultrasonic repellers that emit high-frequency sound and bug zappers, where bugs are attracted to a light and are electrocuted, do not reduce mosquito numbers. Inspection of known mosquito sources is conducted regularly. In Alameda County alone, this amounts to more than 10,000 locations. Yet, the abatement district also investigates new trouble spots. One page on their website allows an individual to request an inspection. A technician will respond within 24 hours. Public contact in response to a service request is one method of outreach by the abatement district. Others include press releases, brochures, and an information table at public events. Valuable information is provided online for both adults and school-aged children. Visit the Alameda County Mosquito Abatement District website at www.mosquitoes.org or call them at 510-783-7744. Here are some other important sources of information. The Alameda County Public Health Department. Visit their website or call 510-267-8000. Also, the Vector Control Services District is headquartered in Alameda. Call them at 510-567-6800 or visit their website. And here's where you can find the California Department of Health Services website. And finally, the CDC, or Centers for Disease Control and Prevention, is located at their website. We've seen how comprehensive programs of pest management can modify or eliminate habitats where mosquitoes breed. Biocontrol, or the use of natural predators, can further reduce mosquito populations. On occasion, larvicides or adulticides might be necessary. We've also seen how individuals can protect themselves with simple measures like emptying standing water, wearing long sleeves, and using a repellent. The Hollywood film Jurassic Park entertained audiences with a science fiction that dinosaur DNA could be recovered from prehistoric mosquitoes. We leave you with a more sobering science fact. Today's mosquitoes transmit disease to 700 million people each year. Some of us will continue to dream of recreating the dinosaur in the future, but all of us can take action now to avoid mosquitoes carrying West Nile virus.
If you're like me, you hate to get sick. Mosquitoes that carry the West Nile virus can make you very sick. Be smart, protect yourself. As the sun goes down, roll your sleeves down and use repellent spray.
To learn more, call 510-783-7744 or visit the Public Health Department website at www.acphd.org.
Remember, as the sun goes down, roll your sleeves down. And at the end of the day, use your spray.
Si ustedes como yo no le gusta enfermarse, los mosquitos que acarrean el virus del Nilo pueden enfermarle seriamente. Sea inteligente, protéjase. Al atardecer, bájese las mangas y póngase repelente. Para saber más, llame al 510-783-7744 o visite el sitio de internet del Departamento de Salud Pública www.acphd.org.
如果你好似我一樣，你會唔喜歡生病？蚊可帶有西尼羅河病毒，而令到你生病。你要保護自己，當太陽下山，把你嘅衫袖放下，用蚊怕水。想認知西尼羅河病毒，請電783-7744，或者到 Alameda 縣公共衛生部嘅網站 www.acphd.org。
Human patient simulation on the public's health.
Well, Celeste, thank you very much for having us here at your Sim Center.
You're welcome.
Did you, in your training, go through simulation?
Some level of simulation. When you stick a needle into an orange to simulate giving a shot, that's simulation. So the truth of it is we've been doing simulation for a long time. And most of us who've gone through training, healthcare training, you yourself, what we call body parts, where you would have an arm and put an intravenous line into an arm, that's simulation as well. But no, I did not in my training, and I finished my training in anesthesia in 1988. So it's relatively new. We did not use the sophisticated mannequins, computerized equipment. It's a relatively new thing. The scenario that we're watching here puts the student in a very challenging situation.
I'm a student now, and I'm in a sim lab, and I'm a nurse anesthetist, and I'm looking at a monitor. And there's a blood pressure, and there's a heart rate, and there's a respiratory rate. And somebody will just create a scenario where the blood pressure drops and the heart rate picks up, and the student will have no idea what's happening, and they will have to make an assessment about what's happening and figure out whether there's myocardial infarction or perioperative ischemia going on in that setting.
Hopefully they will have some idea of what is going on because they have the data that we're presenting them with. We are presenting them with the data they would see in real life, what is on the monitor, what the patient is exhibiting, and they know a lot about the scenario, the context. They are given the opportunity to take that, process the information, make an assessment, go through a clinical decision-making process, and make a decision and implement it. So that's really what we're trying to get them to do. The decision-making skills are the ones that can
that's
be really,
exciting.
It is. The best part about this learning is they'll go through the scenario, but after we run them through the scenario, we take them into what we call a debriefing, and that, by all accounts, is the most important part of simulation. So we can use the videotape to highlight events and to really show them what it is that they did. There's nothing more powerful than watching yourself on tape. But that, by all accounts, is the most important part of a simulation, where they debrief, and that's where the real learning happens.
Well, I've got hospitals and I've got patients, and I can run my students through hospitals where they actually meet real patients and have real life experiences. Why should I do this simulation thing?
That's a great question. For a long time, that's why simulation really didn't take hold as a methodology. One of the reasons is these days it is difficult, in fact, to get nursing students into a sufficient number of patient care settings where they actually are exposed to the types of illnesses, the types of situations where they need to have basic training. The second reason is that once one sees how effective the learning is in the type of setting where the students experience the learning and are able to reflect upon what they learn, guided by their faculty, it's very much more powerful and effective, and there is data to suggest that that's the case.
What do your students say about it when they go through this?
What I get out of the sim lab is a really strong foundation for what's going to happen in the real world.
Scenarios are pretty, they feel really real. You don't really notice that
just a mannequin.
It's so real in the sense that we really become comfortable with how we treat our patients. So when we go into the OR, we're not thinking about it, we're just doing it.
There's a difference between reading it in a book and actually going through the steps, and although it's not a real patient, I think it definitely gives us a step up for, when we go into the OR and actually doing our real patients.
So Samuel Merritt's been doing some things to try to bridge the gap between the demand for the workers and the potential workforce that's out here in Oakland and elsewhere. How does the SIM Center sort of fit into that whole notion? Is it an issue of exposing kids to health careers? Is it an opportunity to actually bring people in here who otherwise you wouldn't be able to bring into a healthcare setting as easily? Is that one of the ways in which the Simulation Center helps?
That's one of the strategies actually that we use simulation for, improving the quality of the education. The students are retained in the programs. They're probably more interested as well, I can tell you that from experience, and therefore we get a larger number of product at the very end.
We've had a tour of your very interesting facility, and you have very sophisticated machinery and programmers and audiovisual equipment and the like. Is this an expensive way to train students?
The expense is certainly balanced by the effectiveness of the educational techniques that you can use once you know how to use this very fancy equipment. The other thing is that simulation does not have to take all this fancy equipment that we have here. We happen to be blessed with that, and we happen to have a large core of people who want to learn, who are willing to learn, and are willing to train us. But you can do very, very effective simulation with half the amount of equipment that we have here, and I think it's important for people to realize that.
Well, anything else you want the viewers to know about this wonderful resource?
It's just an exciting time for simulation. All kinds of technology is happening at lightning speed. So I just encourage anyone who's interested at all, who has an interest. There are lots of resources for information. There are a lot of ways to get involved, whether you're an educator. If you're a student, you should demand this, actually, is what I would say, so that we really can respond to the need. And I think it's a wonderful way to learn.
Great. Well, thank you very much.
You're welcome.